This is Mr. Eugene, and today we're examining one of the most insidious developments in modern dating and relationships. A manipulation tactic so sophisticated, so culturally sanctioned, so dressed up in the language of mental health and emotional intelligence that most people can't recognize they're being controlled until they're already trapped. Therapy speak has been weaponized. Terms that were developed by psychologists to describe genuine pathology and facilitate healing have been hijacked, bastardized, and deployed as weapons in relationships, not to promote understanding or growth, but to control, manipulate, and avoid accountability. You've heard this language everywhere in modern dating. You're gaslighting me. I need to set a boundary. That's emotional labor I'm not willing to perform. You're being emotionally abusive. I'm triggered by that. You're not respecting my boundaries. That's toxic behavior. You're love bombing me. I need you to validate my feelings. On the surface, this sounds like emotional intelligence. It sounds like people who've done therapy, who understand psychology, who are capable of articulating their emotional needs and protecting themselves from harmful relationship dynamics. But increasingly, especially among certain demographics of modern women and the men who've absorbed this language from them, this isn't emotional intelligence at all. It's manipulation dressed up in therapeutic language to make it seem legitimate. Today we're examining how therapy speak gets weaponized in relationships, the specific terms that get misused most frequently and what they actually mean versus how they're being deployed, how to distinguish between genuine emotional intelligence and therapy-coded manipulation, why this tactic is so effective at controlling partners who want to be supportive, the catastrophic damage this does to relationships, and most critically, how to recognize when you're being manipulated with therapy language and what to do about it. This is not about dismissing legitimate mental health concepts or discouraging people from using therapeutic language when appropriate. This is about recognizing when that language has been twisted into a weapon designed to control you. Stay with me. This might be the most important manipulation tactic you learn to recognize. The rise of therapy speak, how we got here before we examine how therapy language gets weaponized. We need to understand how it became so prevalent in the first place. 30 years ago, the average person didn't walk around talking about boundaries, gaslighting, emotional labor, or trauma responses. Those were specialized terms used by mental health professionals in clinical settings to describe and treat actual pathology. Then several cultural shifts happened simultaneously. Shift 1. Therapy became mainstream and destigmatized mental health treatment went from something people were ashamed of to something people advertised on social media. I'm in therapy became a status symbol, evidence that you're self-aware, working on yourself, emotionally intelligent. This is largely positive. Destigmatizing mental health treatment has helped millions of people get help they needed. But it also created a culture where therapy language leaked out of clinical settings and into everyday conversation. Terms that were meant to be precise diagnostic tools became part of casual speech. Shift 2, social media amplified pop psychology Instagram therapists, TikTok psychologists, relationship coaches, and self-proclaimed mental health advocates started churning out content explaining psychological concepts in simplified, digestible formats. Terms like narcissist, gaslighting, trauma bonding, attachment styles. These became part of the cultural vocabulary. Everyone suddenly had the language to diagnose themselves and others. Again, not entirely negative. Some of this content genuinely helped people understand dysfunctional patterns, but much of it was oversimplified, misapplied, and divorced from the clinical rigor that makes these terms meaningful. People learned therapy vocabulary without understanding the nuance, context, or actual diagnostic criteria. Shift 3. Victimhood became currency modern culture, especially on social media and in progressive spaces, rewards victimhood. The more oppressed you are, the more marginalized you are, the more trauma you can claim, the more social capital you accumulate. This created incentive to adopt victim narratives. Not because people are lying necessarily, but because genuine or perceived victimhood grants sympathy and attention, moral authority. You can't criticize me, I'm traumatized, excuse for poor behavior, I acted that way because of my trauma, protection from accountability. Your victim blaming therapy language provided the perfect vehicle for claiming victimhood in relationships. If you can frame yourself as the victim of gaslighting, emotional abuse, boundary violations, you've established yourself as the injured party regardless of what actually happened. Shift 4. Accountability became optional. Traditional relationship dynamics required both parties to take responsibility for their behavior, their contribution to conflict, their role in problems. Modern therapy speak allows people, especially women who've been trained by culture to never be at fault, to avoid accountability entirely by reframing every conflict as them being victimized by the other person's problematic behavior. These four shifts created the perfect environment for therapy. Speak to be weaponized. Everyone knows the language. The culture rewards those who can claim victimhood most effectively. And there's an entire vocabulary designed to make any complaint sound like legitimate psychological harm. The weaponization, how therapy terms get twisted into control. Now let's examine the specific ways therapeutic language gets weaponized in modern relationships. Gaslighting, the most abused term in modern dating, what it actually means. Gaslighting is a specific, deliberate pattern of psychological manipulation where someone systematically denies your reality, questions your memory and perception, and makes you doubt your own sanity. It's intentional, sustained, and designed to break down your sense of what's real. Classic example, you confront someone about something they clearly did. They don't just deny it, they tell you it never happened, that you're remembering wrong, that you're crazy for even thinking it happened. They do this repeatedly and systematically until you genuinely start questioning your own memory and perception. How it gets weaponized. Any disagreement about what happened or what was said gets labeled. Gaslighting. You remember a conversation differently than she does, you're gaslighting me. You point out that she said something contradictory, stop gaslighting me. You question her version of events, that's gaslighting. You suggest her perception might be inaccurate. You're trying to make me think I'm crazy. Why this is weaponization. Disagreement is not gaslighting. Having different memories is not gaslighting. Questioning someone's perception when you genuinely believe they're wrong is not gaslighting. But by labeling any disagreement as gaslighting, she makes herself automatically right. Questioning her becomes abuse, makes you automatically wrong. Disagreeing makes you an abuser, shuts down any possibility of productive. Disagreement positions herself as a victim of psychological abuse, makes you afraid to ever question. Her version of reality is control disguised as self-protection. Boundaries. The excuse for selfishness, what they actually are. Boundaries are limits you set about how you allow yourself to be treated and what you will or won't accept in your life. Healthy boundaries protect your well-being without controlling others' behavior. Classic example, I won't accept being yelled at. If you yell at me during arguments, I'll leave the room until you can speak calmly. How they get weaponized, boundaries get used to control what the other person is allowed to do, say, think, or feel. Not just how they treat you. Weaponized boundaries. I have a boundary that you can't talk to your ex. That's not a boundary. That's controlling who we can speak to. I'm setting a boundary that you need to text me throughout the day. That's not a boundary. That's a demand. My boundary is that you have to agree with me when I'm upset. That's not a boundary. That's thought control. I need you to respect my boundary by not bringing that up. That's not a boundary. That's censorship. Why this is weaponization. A real boundary controls your own behavior. If X happens, I will do Y. A weaponized boundary controls the other person's behavior. You must do X or you're violating my boundaries. When someone weaponizes boundaries, any pushback becomes boundary violation. You're painted as disrespectful for not complying with unreasonable demands. They can make unilateral decisions and call them boundaries. You're constantly walking on eggshells trying not to cross invisible lines. They have total control disguised as self-care emotional labor. The excuse for not contributing what it actually means. Emotional labor originally referred to the work of managing emotions as part of a job. Service workers maintaining pleasant demeanor. In relationships, it came to mean the cognitive and emotional work of managing household, relationships, and family functioning, often disproportionately falling on women. Legitimate example, one partner manages all the household organization, remembers everyone's schedules, plans events, coordinates family life, while the other partner does none of that cognitive work. How it gets weaponized, any request for basic relationship reciprocity gets labeled emotional labor she shouldn't have to perform. Asking her to be supportive when you're struggling, I'm not your therapist, that's emotional labor. Wanting her to remember important dates, I'm not doing emotional labor for you. Expecting her to contribute to household planning, that emotional labor isn't my responsibility. Asking her to care about your feelings. I don't have capacity for that emotional labor. Why this is weaponization, basic reciprocity in relationships isn't. Emotional labor. It's partnership. Supporting your partner emotionally isn't work you're entitled to refuse. It's fundamental to relationship. But by labeling any emotional engagement as labor, she gets to opt out of basic partnership responsibilities, frames reasonable expectations as unreasonable demands, positions herself as exhausted victim of your neediness, avoids having to care about your emotional well-being, makes you feel guilty for having normal relationship needs triggered, the excuse for any emotional response. What it actually means, being triggered, is when something in the present activates unprocessed trauma from the past, causing an intense emotional physiological response disconnected from the current situation's actual severity. Legitimate example, a combat veteran hears fireworks and has a trauma response because it sounds like gunfire. Their nervous system is reacting to past trauma, not present danger. How it gets weaponized, any uncomfortable emotion gets labeled as being triggered to make the other person responsible for managing it. You do something she doesn't like. I'm triggered by that. You disagree with her. That's triggering for me. You set a boundary. You're triggering my abandonment trauma. You have any expectation. I feel triggered when you ask me for things. Why this is weaponization. Not every negative emotion is a trauma response. Sometimes you're just upset, annoyed, or uncomfortable, and that's not automatically the other person's fault. When someone weaponizes triggered, you become responsible for managing their emotional state. You have to walk on eggshells to avoid triggering them. They never have to take responsibility for their reactions. You can't have normal conflicts because everything triggers them. Your behavior is constantly restricted by their claimed trauma toxic. The label that ends all discussion what it actually means, toxic behavior is consistently harmful, destructive patterns that poison relationship dynamics, manipulation, control, abuse, chronic disrespect. Legitimate example, someone who consistently belittles, manipulates, isolates, and controls their partner is exhibiting toxic behavior. How it gets weaponized? Any behavior she doesn't like gets labeled toxic to make it sound abusive. You express frustration, that's toxic anger. You want time with friends, that's toxic avoidance. You disagree with her, you're being toxic. You don't text back immediately, toxic communication patterns. You have any negative emotion, toxic masculinity. Why this is weaponization, the word. Toxic has become so diluted it's nearly meaningless, but it still carries moral weight. If your behavior is toxic, you're automatically wrong and harmful. When someone weaponizes toxic, normal human behavior gets pathologized. You're put on defensive for being normal. She claims moral high ground automatically. You start questioning whether you're abusive for being human. The relationship becomes therapy session where you're the patient. The pattern, how weaponized therapy speak sounds in practice. Let me give you a composite example of how this actually sounds in a relationship where therapy speak has been weaponized. Him, I've noticed you've been really distant lately. Is everything okay? Her, wow, that's actually gaslighting. I'm not being distant, you're just upset that I'm setting healthy boundaries by not being available 24/7. I'm not going to perform emotional labor by constantly reassuring you. That's triggering for me because my ex was really clingy. You need to work on your anxious attachment instead of making me responsible for your feelings. This whole conversation feels really toxic. Let's break down what just happened. He expressed a legitimate observation and concern. She immediately labeled it gaslighting. It's not. He's sharing his perception. She reframed basic availability as boundaries, not boundaries, just distance. She labeled basic relationship communication as emotional labor. She claimed his reasonable concern triggers her. She pathologized his need for connection as anxious attachment. She blamed him for making her responsible for his feelings when he just asked a question. She labeled the entire normal exchange as toxic in one short exchange. She avoided answering the actual question, made him the problem, positioned herself as the victim, used 5 different therapy terms to justify not engaging, made him feel like he's being abusive for having a normal concern. This is weaponized therapy speak. And men encounter this constantly in modern dating. Why this tactic is so effective. Control weaponized therapy speak is particularly effective as a manipulation tactic because, reason 1, it comes with built-in moral authority. Someone uses therapy language, they sound educated, self-aware, emotionally intelligent. You don't want to be the person who disrespects therapy concepts or dismisses mental health. So even when something feels wrong, you hesitate to push back. If she says, you're gaslighting me, challenging that feels like you're dismissing her mental health reality. If she says she's triggered, questioning that feels like you're invalidating her trauma. The language itself creates a shield. To disagree is to be insensitive, uneducated about mental health, or abusive. Reason 2, it pathologizes normal behavior. When everyday human behavior gets labeled with clinical terms, normal becomes pathological. You expressing frustration becomes toxic anger. You wanting connection becomes anxious attachment. You questioning her version of events becomes gaslighting. You having expectations becomes violating boundaries. Suddenly you're not just wrong, you're psychologically disordered, and that puts you perpetually on the defensive, always trying to prove you're not abusive, toxic, disordered. Reason 3. It creates unfalsifiable accusation show. Do you prove you're not gaslighting someone? If they say you are and you deny it, doesn't that just prove you're gaslighting them by denying their reality? How do you prove your boundary is reasonable if she says it violates hers? Boundaries are subjective, so who's to say whose is valid? This creates a trap where defending yourself looks like evidence you're guilty, and that's intentional. Reason 4, it appeals to good man instinctsmen who are actually good, who want to be supportive partners, who take mental health seriously, who don't want to cause harm, are most vulnerable to this manipulation. Because when she says you're gaslighting her or violating her boundaries or triggering her trauma, if you're a good man, your instinct is take her claim seriously, examine your behavior, feel genuinely concerned you might be causing harm, modify your behavior to stop the claimed harm. That's exactly what she's counting on. Your goodness makes you manipulable by these claims. Reason 5, it allows complete avoidance of accountability as the ultimate function. By framing every conflict as you harming her, gaslighting, boundary violation, emotional abuse, triggering, she never has to take accountability for anything. She behaved poorly. I was triggered. She lied. I have different boundaries about honesty. She's being unreasonable. You're gaslighting me by calling me unreasonable. She's demanding and controlling. I'm just setting healthy boundaries. She won't compromise. Compromise would be emotional labor. I'm not willing to perform. Every single conflict becomes about your failure to respect her psychology rather than about her actual behavior. She's never wrong. You're just always traumatizing her. Distinguishing genuine emotional intelligence from weaponization. How do you tell the difference between someone who actually understands psychology and someone who's weaponizing therapy language? Genuine emotional intelligence uses therapy terms accurately and sparingly, doesn't throw around. Gaslighting, or narcissist casually, uses clinical terms when they actually apply, takes mutual responsibility, recognizes that both people contribute to relationship dynamics, uses I statements about their own experience rather than you accusations, seeks understanding, not control, uses psychological concepts to foster understanding and growth, not to win arguments or shut down conversation, explains and discusses. When they use a term like boundary, they explain what they mean, why it matters, and are open to discussion about whether it's reasonable. Tolerates disagreement, can have their perception questioned without labeling it gaslighting, can have their boundaries discussed without claiming violation. Shows empathy, considers your experience and feelings, not just their own. Psychological awareness runs both directions, demonstrates flexibility, understands that relationships require compromise even around boundaries and needs, works toward solutions, uses psychological understanding to identify problems and work toward fixing them together. Weaponized therapy speak, throws around terms constantly. Every conflict involves gaslighting, boundaries, triggers, toxic behavior, emotional labor, trauma. Assigns all blame to you. Every problem is framed as your psychological failure. They're always the victim. You're always the perpetrator. Uses terms to shut down conversation. Deploys therapy language to end discussion, not facilitate it. That's gaslighting, means stop talking. Provides no explanation, states that you're violating boundaries or being toxic without explaining how or why. The label itself is supposed to be enough. Cannot tolerate disagreement. Any questioning of their perception or terminology is itself labeled as abuse. You're not allowed to see things differently. Shows no empathy. Your feelings don't matter when they're triggered or you're violating boundaries. It's entirely about them. Completely inflexible. Boundaries are non-negotiable. Triggers must be accommodated. Completely. No compromise is possible without them being victimized. Creates perpetual crisis. Every interaction is a mental health crisis. You're constantly causing them psychological harm that must be addressed. The key difference: genuine emotional intelligence creates clarity, understanding, and growth. Weaponized therapy speak creates confusion, control, and perpetual victimhood. The damage what weaponized therapy speak does to relationships. Let me trace the progression of how this manipulation tactic destroys relationships. Stage 1, confusion, weeks 1 to 8. You start noticing she uses a lot of therapy language. Initially, you think this is good. She's self-aware, emotionally intelligent, has done work on herself. Something feels off. Conversations that should be simple become complicated psychological analyses. You're constantly being told you're doing something psychologically harmful, but you're not sure what or why. You're confused but willing to learn. Maybe you don't understand boundaries well enough. Maybe you are gaslighting without realizing it. Maybe you do have toxic patterns. Stage 2, self-doubt, months 2 to 6. You start questioning everything about yourself. Are you emotionally abusive? Do you gaslight people? Are your needs toxic? Is your attachment style disordered? You're walking on eggshells trying not to trigger her, violate her boundaries, require emotional labor, or be toxic. But you keep failing because the rules are unclear and constantly changing. You start seeing yourself as the problem. She's using all this psychological language. She seems to understand how relationships work. So if she says you're the problem, you must be the problem. Stage 3, control. Month 6 to 18, she's established complete control using therapy language as the tool. You can't question her because that's gaslighting. You can't have needs because that requires emotional labor. You can disagree because that violates boundaries. You can't be upset because you're being toxic. You can't want connection because that's anxious attachment. Constantly managing her psychological state while getting none of your needs met. The relationship has become entirely about preventing her from being triggered or her boundaries from being violated. You've lost yourself trying to be whatever she needs you to be to avoid being labeled abusive. Stage 4, crisis. Months 18 plus one of two things happens. Option A, you finally recognize the manipulation and attempt to set your own boundaries or push back. She escalates, labels your entire personality as toxic, possibly threatens to leave or does leave. You're left devastated and questioning whether you're an abusive person. Option B, you stay completely broken. The relationship continues with you as the identified patient whose psychological problems are the cause of all conflict. You live in perpetual state of trying to fix yourself while she avoids all accountability forever. Either outcome is destructive. The manipulation has either destroyed the relationship or destroyed you. How to respond, what to do when someone weaponizes therapy speak against you. If you recognize that someone is weaponizing therapy language to control you, here's how to respond. Step 1, name the pattern, don't let it operate invisibly. When she deploys therapy speak inappropriately, call it out. I understand you're using psychological terminology, but I don't think you're using it accurately. Having a different memory of what was said isn't gaslighting, it's just disagreement. Let's discuss what actually happened rather than labeling disagreement as abuse. I hear you saying that's a boundary, but boundaries are about what you'll accept, not about controlling what I do. You saying I can't talk to my friend isn't a boundary, it's a demand. If you're uncomfortable with my friendship, we can discuss that, but you don't get to control who I speak to and call it a boundary. Step 2, require specificity, don't accept vague therapeutic accusations. Her, you're gaslighting me. You, that's a serious accusation. Explain specifically what I did that constitutes gaslighting according to its actual definition, which is systematically making you doubt your reality. How am I doing that? Force her to get specific. Weaponized therapy speak relies on vague accusations. Actual psychological concepts have specific meanings. Make her explain using those actual meanings. Step 3, refuse to accept labels. Don't internalize her diagnostic labels. Her, you have toxic anger issues. You, I don't accept that label. I expressed frustration, which is normal human emotion. If you have a concern about how I expressed it, we can discuss that specifically. But labeling normal emotions as toxic is manipulative. You define yourself, not her. Don't accept psychological diagnoses from someone who isn't your therapist and is using terms to control you. Step 4, establish your own boundaries. Use actual boundaries, controlling your behavior, not hers. I won't continue conversations where normal disagreement gets labeled as abuse. If you can't discuss disagreements without calling it gaslighting, we'll end the conversation and revisit when you're ready to engage productively. I won't accept being told my normal relationship needs constitute emotional labor. If you're not willing to provide basic emotional support in a partnership, we need to discuss whether this relationship works. Step 5, consider whether the relationship is viable. If someone is deeply invested in weaponizing therapy speak, they may not be capable of healthy relationship. Can they acknowledge when they use terms incorrectly? If you explain what gaslighting actually means, and they still insist every disagreement is gaslighting, they're not operating in good faith. Can they take any responsibility for relationship problems? If everything is always your psychological failure and never their contribution, that's not partnership. Are they willing to compromise? If every boundary is non-negotiable and every trigger must be completely accommodated, they're not capable of adult relationship. If the answer to these questions is no, if they cannot engage with psychological concepts honestly and are using them purely to control you, the relationship cannot be saved. You're dealing with someone who will perpetually position themselves as victim and you as abuser, and there's no coming back from that dynamic. Final thoughts. Reclaiming psychological language. Here's what men need to understand about this phenomenon. Therapy language and psychological concepts are genuinely valuable. Understanding attachment, boundaries, emotional labor, trauma responses, these concepts can help people build healthier relationships. But like any tool, they can be misused. And increasingly, they're being misused by people who've learned the vocabulary without understanding the concepts and who deploy that vocabulary to manipulate rather than to heal. You're not crazy for feeling manipulated when someone uses therapy speak against you. You're not uneducated about mental health for questioning whether disagreement is really gaslighting. You're not insensitive for pushing back on unreasonable boundaries. You're recognizing manipulation. And the fact that the manipulation uses therapeutic language doesn't make it less manipulative, it makes it more insidious. The solution is to learn what these terms actually mean so you can spot misuse, refuse to accept psychological labels from non-professionals who have agendas, call out weaponization when you see it, establish your own actual boundaries about how you allow yourself to be treated, leave relationships where weaponized therapy speak is the primary communication. Style therapy speak should facilitate understanding, healing, and growth. When it's being used to control, blame, and avoid accountability, it's not therapy speak anymore. It's just abuse wearing a therapeutic mask. Drop a comment about your experience. Have you encountered weaponized therapy speak? How did you handle it? Subscribe because this channel will continue exposing manipulation tactics that hide behind legitimate concepts, teaching you to recognize control even when it's dressed up in the language of mental health. Stay clear, stay boundaried, and never accept being labeled abusive for having normal human needs and responses.